Good afternoon again, everybody. Thank you so much for coming to this public meeting, COVID Action Scotland, on the topic of COVID and the immune system. We're absolutely delighted to have with us today Professor Yaneer Bar Yam, who is the president of the New England Complex Systems Institute and co-founded the World Health Network, which advocates for good science-based public health. Professor Bar Yam has worked in multiple zoonotic outbreaks and has worked with many teams around the world on the current pandemic. Professor Bar Yam is going to speak for about 10 minutes or so, and after that we'll have about an hour and a quarter for questions and comments and hopefully a lively discussion. So without further ado, I will hand you over to our wonderful speaker, Professor Bar Yam.
So it's a pleasure to be here. Thank you for inviting me. And I want to speak about the subject, but I'm happy to take other questions as well that you may be interested in. And the task that I've been given is to talk about the immune system and the effects of COVID. Let me start by expressing appreciation for the recent action that has been taken in the UK to protest the conditions of precautions in healthcare. I think that the situation in the UK, as everyone knows, has been quite difficult, and it's of course hard to change directions. And I do think that it's something to acknowledge that there is a movement, and under these circumstances, once movement begins to happen, it can grow and cascade and become much larger than people expect when it begins. So I look forward to that taking place. Thank you. Let me talk a little bit about the immune system, setting the frame, and then talking about some specific issues that I think will be of interest. First of all, the fact that the immune system is harmed by a disease should not be surprising. The immune system is a system that one can really understand in a way somehow that is not being taught very successfully in schools. People talk about immunity as if it's a shield, this kind of magic shield that people have that then prevents any future harm. And immunity doesn't work that way. The immune system is a system of cells and processes and structures that are responsible for protecting the body from typically microscopic attacks. And the system maybe better can be understood if we think about it in relation to the society or the country being protected by the systems that protect the society or the country, such as particularly the military, which is designed to withstand attacks from the outside. And if there is an attack, the military can be strengthened in order to withstand future attack. It's possible, but that doesn't make it invulnerable to other attacks. Neither does the presence of an attack guarantee that the military will be strengthened. It may be weakened, and substantially so that future attacks are able to become harmful even with small attacks. Is it clear what I'm saying, that there is this wide range of possible outcomes of an attack that we see in the real world, right? We have a war in Ukraine. going on now with the attack from Russia, and we don't know what the outcome will be. And the same thing is true when there's an attack on a system, um, on the immune system. Again, it's a real world system. It's not a magical thing. It's not um, Hollywood construct of some kind of invincible shield. And this is often the way the word immunity is used. Immunity seems to imply it, right? Immunity means there's no vulnerability in the language that we use. And so this is an incorrect word that creates inappropriate associations for how the immune system functions and what is the consequence of an infection. Also, of course, what is the consequence of vaccination, which again is designed to create some amount of immunity for a particular pathogen, but in general has a variety of consequences that range from very high levels of protection to very limited levels of protection. Is it clear? Okay. And just to elaborate a little bit, one of the things that happens is that people become, because, I mean, in military is a very complex entity with different kinds of forces and different kinds of interaction and different kinds of weapons and so on and so on. The same thing is true about the immune system. It's highly elaborate structure with different kinds of cells, elaborate communications among cells, and elaborate um, uh, uh, structures as well. Immune system includes the barrier structures of the body, like the skin, and many other aspects of the physiology and the processes of the cells themselves. Indeed, if one were to attribute a cell to have the most similarity, if you will, to a human being, immune system, because of the elaborate nature of the communications among cells, evokes that correspondence in a way that other cells do not. Is it clear? Okay. So let me take a few moments to talk about the history of the evidence about harm to the immune system counter to the standard textbook narrative about how the immune system responds to infections, um, and describe that just a little bit. And again, these issues are not unique to COVID, but surely COVID is a dramatic example of harm to the immune system. And when I say that it's not unique, the one example that everyone is generally familiar with is HIV. They are different, of course, and people bristle at the discussion of the two in the same sentence, but each of them causes harm to the immune system. And I can explain, if you choose, what is the kind of harm and process that happens with HIV. And I can explain somewhat, though it's not fully understood, the harm due to COVID. Now, early in the pandemic, it did not take long for it to be clear that after an infection with COVID, the key immune cells were dramatically depleted. The presence of the immune cells decreasing was very well noted in the early stages of the pandemic. And this was also reported in the press. right? There was a New York Times article, I don't have that in front of me, that said that COVID is like HIV, it depletes the immune cells. This became an inconvenient truth when it was decided that it was important to return to normal. And but the evidence for this came very early. There is a term that I want to remember exactly how it's said. It's lymphocytopenia is the condition of having an abnormally low level of lymphocytes in the blood. And this was diagnosed very early on, and I will give you a place where you can find all the references. Now, as the information about the physiological impact of COVID was learned about, this counter to textbook understanding became contentious in the scientific community. Science is full of both, how do I say this, is full of hypotheses that are only in process of being validated. And often scientists in advocating, that end up advocating for a particular hypothesis. This is different from what is established science. Is it clear what I'm saying? There is a confusion because when we think about what science is, we think about the science that is validated science. That's science. But the process of science doesn't start with validated things. It starts with ideas that are tested over time and eventually either rejected or accepted, and sometimes more correctly, are being demonstrated to be applicable under certain circumstances and not under other circumstances. And so it becomes the issue becomes to understand under what circumstances they become valid. When college students are taught, very often they are taught ideas that help people understand what's going on in a system, like the immune system, such as the adaptive immune system that learns to respond to particular types of pathogens, to a particular pathogen rather than general defense. And that idea, the idea of that is being taught. And so thinking about that idea a lot leads people to think that this is a truth rather than a conditional hypothesis. Is it clear? So it's a very important, and I mean, there's efforts to do this, right? But the danger of scientists that get engaged with an idea that they learned in college is that later they forget that there are assumptions or conditions under which they apply. And so this has created a conflict within the scientific community that is mostly based upon the existence of assumptions that are not tested. And this is a critical challenge for science, but it is a critical, much more difficult problem for science that is applied to policy. I know for years that scientists engage in these conflicts about scientific ideas, but that's reasonable because they're learning and they're learning. So the one way to learn is that you have these mock trials, right, where A advocates for this idea and B advocates for another idea. And over time, you resolve the conflict. But when you apply science to policy, you can't do that. Everybody has to align around the understanding of what are the validated assumptions in order to be able to proceed with policies that affect lives, health, lives, economies, um, uh, as a result of policy decisions. Okay? What I want to do now is go, because I've spoken a little bit more generally, and I intended to move directly into the discussion. Let me now go directly into the discussion of the immune system effects beyond the original characterization of the lymphocytopenia, the reduction of lymphocytes after COVID infection. So the first thing that I want to do is point you to an article. I will share my screen and show it to you. This is a very powerful summary of let me just, everyone here. This is a article that came out about a year ago. And the article is written by Andrew Ewing. It is a summary and resource on the immune system effects that had been documented in scientific works up until that time. I just want to go down to the bottom here. This is a reading list which has articles in chronological order starting in March of 2020. March of 2020. And in March of 2020, an article was already published. Is it clear? So the results were known immediately. And the reason why the results were known immediately is because these are the direct measurements of people who have COVID. There's no doubt that when a patient goes into a hospital with a COVID infection, immediately afterwards, with very high probability, the total number of these kinds of immune systems was decreased markedly. This is not ambiguous. This happens all the time. It's a pervasive observation. It happened from the beginning. Now the people want to figure out, well, what does this mean? You understand? What is the significance? What are the details? What are the mechanisms? And all of that is going to be studied extensively. And by a year ago, there were, I don't remember, over 50 articles detailing many of the issues involved in the immune system behavior. Okay? So I just want to be clear, there is no doubt of the effects of the disease on the immune system. The impact of those on subsequent harms then becomes the question. So again, first of all, there is the what. Then there's the mechanism. And as an example, one of the mechanisms that was shown is that the immune cells are actually directly infected by the virus, by a mechanism that's not the usual mechanism of cells being infected as they are in most of the tissues in the body. There's a separate mechanism. There were all kinds of details that were shown about how it affected, when it affected, what's going on, how long is it going to last, right? Because some of the questions are, does it stay on around for a short time? Does it stay around for a long time? The answer, it persists, like many of the other harms in the body, and so on. So it's worth learning about many of these effects and to understand many of the scientific details. But the upshot is, over time, they've learned more and more about what's going on. The second question is, what are the impacts? Now, if you eliminated your immune system, you wouldn't live for very long, right? So when the immune system is harmed, the next step is, how do you characterize all of the impacts of the immune system, right? Well, what does the immune system do? So one of the things that we mentioned that the immune system does is that it combats pathogens, right? Things that are coming into your body, viruses, bacteria, fungus, and so on, that go into your body and are trying to use you as food. Okay? So the immune system defends yourself against those attacks. Another thing that the immune system does is it prevents cancers from developing. It recognizes when there's a cancer many times and attacks that. Um, Harms to the immune system can also cause the immune system to attack the wrong thing. So one of the key aspects of the immune system is its ability to recognize who's foe and who's friend, right? Which cells are your cells versus which cells are attacking you. And if the immune system goes haywire, it can start attacking your cells. Autoimmune disease, autoimmune disorders, all kinds of things that happen in that case. It's like if the military is all of a sudden attacking the country's people. Does that happen anywhere? Sure. Okay, so the question becomes, what are all of the different ways that the immune system can be harmed in its effects? And those have to be detailed by other kinds of experiments, because otherwise scientists and otherwise say, well, that doesn't matter, right? The fact that we have this lymphocytopenia or whatever, why does it matter? And the answer is, we have to look at those effects. And all of the effects that I've mentioned are seen, including something that takes longer to study, which is susceptibility to cancers. And that raises a lot of flags. But of course, the first flag is this issue of the ability of the body to protect you from viral, bacterial, fungal infections and autoimmune effects. Now, autoimmune effects are a lot of studies about autoimmune effects after COVID. What I want to do is to focus on the protection from attacks of other microorganisms, okay? And I just want to point to two articles. One of them was pretty early on in 2021 and has a lot of information about this, actually a huge amount of information. And I just want to show you that discussion. Now, this article is very distinctive because it has a huge amount of information. And because it has a huge amount of information, the people don't see all of the things that are in it. In fact, all of the information that I'll tell you is not described in the article. It's described in a supplementary table. Okay, so let me share my screen and I'll show you how this works. So this is one of the outstanding articles by Ziad Al-Ali and his team. Many of you probably know that he is using a huge database, which is the Veterans Administration database of data in the US. And it has, this article is high dimensional characterization, meaning they took a very large set of measures of what goes on and analyzed the changes in it when you compare people who had COVID and people who didn't have COVID, and they matched these people so that otherwise they were the same. And they have some beautiful figures. This is a classic high dimensional figure where what they're doing is they're showing each one of these lines is kind of a direction in the space of different things that might happen. And over here, you see there's an infectious category. You see this? And so somewhere in this is many of the infections, but other ones there might be in other, some of the infections are in other categories, but doesn't matter. You see how a lot of information there is. In the supplement of this paper, so you have to go all the way down and look at the supplementary information. You see where I'm clicking on this part of the outline? It's after the references, after the acknowledgements, after all of this, there is a supplementary information. And here's supplementary table 2. If you click on it, you can download the table and you can look through the table and look for the impact on infection rates. Is it clear? With and without COVID. All right. So now, where do I go? I have to show you a summary table. I want to show you that this is a summary table. This is something that's in process. But this summary table, starting from the second row, has information from that paper. And what it says is that respiratory infections are increased by 40%. They're multiplied by 1.4. Bacterial infection by 43%, fungal infections by 21%, parasitic infections by 82%, viral infections, this is all viral infections, and this is multiplied by over 4 times. And then there's sinusitis and skin infections and urinary tract infections and intestinal infections and STDs and acute bronchitis and acute and chronic tonsillitis and influenza, and pneumonia is multiplied by a factor of 3. And this is a summary statement about reports of sequelae of infectious disease conditions. It's one of the categories. So they took all of the reporting categories, and this is multiplied by almost a factor of 15. So the point of this table is just, if you take that large database of people and you say, okay, what are the same people who had COVID and don't have COVID experiencing in terms of the number of infections that they're having, the increase is huge. And it's consistent across many, many categories. So it's not one thing. In other words, if it was one thing, then there might be one particular cause of that. But the thing that protects you from all of these things is the immune system. And we know that the immune system has harm. What we're just doing is we're looking for the consequences. And these two pictures are completely consistent with each other. Pervasive, consistent harm to the immune system, pervasive, consistent susceptibility to infections of all of the kinds that you would look for. There's one other study that was a very targeted study And this is a study of children aged 0 to 5. And some people have claimed that these are older people in the, after military service, but the truth is there's a wide range of ages. And the comparison, if you do a comparison, you have to show that it doesn't have the same effect in other cases. But this is a study on children aged 0 to 5. What happens? Here is the study. And the study shows in 2 separate years that there is a 40% increase. Do you see this 1.4 factor risk ratio? There. And here is the risk ratio in the other year, 1.32. Totally consistent within error bars, right? Because this goes up from 1.12 to 1, but it's greater than 1, and it may be as well much as 56% larger. So 1.32, 1.4, it's totally consistent with the other results. 40% increase in this particular infection in children aged 0 to 5. So this is pretty clear. There's one other thing that I want to share with you that I looked at because I was looking at these infection. This is the ending of my story about COVID infections. But I have another sub-story that I want to tell you. One of the things that we've been concerned about is that reporting of numbers is not correct. You're aware of this, right? People have redefined what COVID is. They've redefined what deaths from COVID is, all of these things. And in the UK, we actually have an article where we've written about the UK change in mortality statistics. This can be found in the same place. Here's the article. This is written by Pedro Larias and Heather Sue Rosen. I want to share with you my screen for a moment. I'm not going to go through the article in detail, but this article talks about how in the UK, they made a decision to change their definition of the baseline of COVID. And the result of that was to reduce what was the apparent excess mortality. So they just looked at the number of deaths and they included years that were later in the pandemic. So they combined, instead of using the 5 years before the pandemic and compare it with the years after, they decided to take 3 years before and 2 years during the pandemic in order to reference their death rates. Right? That's not, that makes a lot of assumptions about what's going on, that this is not the pandemic, right? And in fact, that artificially lowers the number of deaths. Recently, there's new reports of a new round of change of definitions, and I don't know the details of it. This just happened in the last month. And I'm not aware of the details, but at least there are reports that a new round of redefinition is taking place. So I haven't been looking at the excess mortality data because I've been concerned that these numbers and the analyses of them indeed are tricky. But I decided recently to look at this matter in one particular country. I only looked in one because I figured that, you know, different countries are going to do different things, but I kind of trust that in Germany, they're just reporting the straight data. And I looked just there, and here's what I found. So this is the accumulative, which means that I'm just adding the additional excess deaths per week, adding it up over time. And what you see is that the excess deaths since just within the first year, kind of after the relaxation of restrictions began toward the end of that year, since then, the excess deaths are on a straight line, which means that there's basically no change in excess deaths, which I have to tell you is surprising, because one might expect that because older people were more likely to die early in the pandemic, that you would get less deaths later because the people who were most vulnerable were dying earlier. But that isn't what's happening. And the one reasonable, but again, it has to be tested, assumption is that there is harm that is taking place to people that is making people vulnerable basically at the same rate that we are losing people. So this has to do with the data that does exist about molecular measures of age that are increasing as people are infected. And obviously, that's something that we would be very unhappy about. Let me stop there.
Thank you so